Hello everyone, welcome to our new episode of Mind-9 series. Firstly, I apologize for the delay in bringing out this episode. Last week was busy and I couldn't record this episode. So here we go with today's episode. Ever since lockdown, if there is one word apart from corona that has constantly been on the rise and spoken about frequently, that is depression. As a mental health professional, I am really glad that more people are now becoming aware of depression, what it is, and they are more readily coming out and expressing their views about depression and sharing their sufferings of depression. So, most of them know what depression is, and hence today I'll be first talking about what depression is not. Depression is not acting or drama, it is true. Depression is not due to past life problems. It is not due to karma. Depression is not due to evil spirits or possession or ghost. Depression does not differentiate between color, race, physical appearance such as well built or poorly built, a muscular body or a lean body. Depression is not a sign of weakness. Most important, depression is not an untreatable illness. It is very well treatable. Most patients describe depression as a feeling of being under the sky that is gloomy and dark. Now, imagine a heavy rainy day where you just want to be in your bed and you do not have any interest to perform any sort of activity. Depression is just like this. Don't worry, if it's just for one or two days, it's not depression. Depression is more consistent and it lasts for days to weeks. So basically the mind just shuts off and they have constant feeling of low mood, loss of interest and decreased energy levels. Along with this, they also have this inability to focus on any activity that they are doing. They are unable to register new stuff that they come across, and that leads to forgetfulness. And some of them also complain of reduced appetite, not able to eat how much they used to eat before, and also have decreased sleep. More often they come and tell me that they're not able to maintain their sleep. They wake up very early, 2:30, 3 a.m. in the morning, and that's when the depression is very bad. The thoughts are really bad. Now, what complicates the issue here is a feeling of guilt. The patient feels that he is useless, that he is guilty of a lot of things, maybe the past, maybe the ongoing situation. Along with this, there are also other symptoms which are very complicated and kind of worsens the picture. That is hopelessness. I am hopeless. I am unworthy of anything. I am unfit. And a sense of helplessness. And this sort of helplessness, when it kicks in, that kind of leads to the feeling of the overall feeling that I am a zero, I am unworthy of anything. So ultimately, all these thoughts lead to suicidal ideas and the act of suicide. But remember, all these symptoms need to be present for at least a minimum of 2 weeks, or it needs to be severe enough to qualify for a diagnosis of depression. So why does this happen? Why do people get depressed? Broadly, it's because of two reasons. First, it is secondary to loss of loved one or a stressor in financial aspects or the academic or at workplace. It could be any sort of major stressor or relationship issues, maybe a love failure or divorce and such other major events in life. This category is called as reactive depression because it is occurring secondary to something. Now the other category, on the other hand, it is called as the endogenous depression, where we do not find a specific major stressor, but still the person is depressed. And in this particular individuals, usually they have a family history of mood disorder or they have a genetic predisposition. And in these individuals, they tend to have significant reduction in neurochemicals in the brain, certain neurochemicals such as serotonin and norepinephrine, etc. Next, coming to the extent of the problem, the prevalence of depression is about 2.7%, and depression is one of the leading causes of morbidity worldwide, not just India. And 1 in 20 Indians suffer from depression, and about 8 lakh suicides occur every year secondary to depression. And mostly the suicides occur because of low income, as the studies say. Coming to the last part of the video, that is treatment, and I wish to emphasize that depression is treatable. Do not have any stigma towards the treatment of depression. And usually in the initial stages, if the depression is a mild one, we stick to psychological therapies, and first and foremost would be to allow the patient to vent out his feelings and his or her thoughts, and then we would initiate talk therapy or certain kinds of therapies like CBT, cognitive behavior therapy, which focuses on modifying the thoughts and behaviors of the patient. And if it is a little more severe, we also prescribe drugs called as SSRIs or SNRIs, which tend to increase the neurochemicals in the brain, the neurochemicals which I had mentioned, serotonin and norepinephrine, etc. So that's it for today. Remember, depression is a treatable illness. The take-home message is not to have stigma towards depression. Depression is just like any other illness, like hypertension, diabetes, and any other infection which needs treatment. So my sincere request is to reduce stigma and to observe people around you who needs help and make sure they get it. Thank you for watching the video. Please like, share and comment, and my request is to share the video not for my benefits but so that more people can benefit out of this. Thank you so much.